Hello, Pat. Neil.
Good afternoon. All right, we got about
Good
45
morning.
minutes that we'll be getting going. I'll go ahead and start sharing my screen then. All right, Mr. Chairman of the board, whenever you're ready, sir, we're ready for you.
All right. Good afternoon, everyone.
Hello.
Thank you all for taking some time out of your busy schedules in the midst of COVID to join us. Thank you as always for lending your time to a worthy cause of trying to eradicate homelessness in our community.
Yeah, I printed it out for my tech guy. He doesn't do it very often, so he's not.
The sad part is that almost looks purple.
Yeah.
Bills,
I was
please.
running out of ink. Don't tell anybody.
Can everybody mute your mics, please?
The sad part is your
All
two
right.
sounds if you're using A or B.
Yeah,
I mean, it'll get you, you know what I'm
yeah,
saying?
yeah, yeah.
And you can use A, but then this is wrong.
Can
Right.
you mute
Let
them?
me see if I can mute everybody. Hold on one second.
Exactly.
Doesn't matter about that.
All right. All right, we'll go ahead and get started again then. All right, thank you, Pat. All right, well, welcome everyone, and we'll go ahead and get started. We know your time is valuable. You got lots of things to do, so we'll jump right on into it. Okay, Pat, you take it away. Thank you.
I forgot to unmute myself. Excuse me. Thank you. Again, thank you for joining us, everybody. We're going to go over some review of coordinated entry for the year of 2020. Normally about this time we are reporting our point in time count numbers and all that, but of course we haven't had point in time count yet this year due to pushing it back because of COVID-19. So we're going to go ahead and take a look at some interesting information that we're starting to dig a little further into as it relates to coordinated entry, and specifically as it relates to how quickly we as providers move people from homelessness to housed. And also, are we doing our due diligence and making sure that everyone we encounter is enrolled in coordinated entry if they are literally homeless, but also if we enroll them in our programs, whether it be rapid rehousing, permanent supportive housing, and now with some of the new ESG CV money in emergency shelter, you have to have these enrolled in coordinated, or you will not be reimbursed for your services. So again, just going to go over some information from coordinated entry for the year of 2020. What we did was we went through HMIS and pulled every client that was enrolled in the year of 2020 in either rapid rehousing or permanent supportive housing. Again, we only pulled those two housing types because at the beginning of 2020, before we had the pandemic, before we had new guidelines to come down about who needed to be enrolled in coordinated entry, at that time, as of January 1 of 2020, only those receiving services or enrolled, I should say, in rapid rehousing and permanent supportive housing were required at that time to be, have come through coordinated entry, have a referral from coordinated entry to that program to be able to access it. So those that we did a small look just on those that met the guidelines as of January 1st of last year. Of the 60 that were enrolled in those rapid rehousing or permanent supportive housing, 50 of them moved in, which is, I think it was like an 83%, yes, 83% success rate of those enrolled to moved in. And actually that seems a little high. And we did some digging and it looks like that we're not enrolling people until we're sure that we're actually going to be able to house them. But we'll talk about that in a little bit. Of those that were enrolled in permanent supportive housing or rapid rehousing, excuse me, 35 of those households were, I say 60 people, it should have been 60 households. I'm sorry, 60 households. 35 of those households were adults only, and 25 of those were households with children. Of those enrolled in those programs, 5 of them were veteran households, and 13 of them were households that were experiencing chronic homelessness. But of those 60 households that were enrolled in those 2 types of programs for that calendar year, only 29 of them, less than 50%, were enrolled in coordinated entry prior to enrollment in the program, which means we did okay, but we did not do our best in making sure that those who were in those programs were enrolled in coordinated entry prior to enrollment in your program. And that, of course, is one of the guidelines for coordinated entry and guidelines for anyone who receives ESG funds or funds through the COC NOFA process. Then we went to dig in a little bit deeper into how long it takes for someone to go from the referral to an agency to the time they move in. And as you can see, we've broken it out in a couple of ways here. From a referral to the enrollment in the program, it's like 39 days. So it looks to, if you're in, when we did some digging as to when people enrolled and then moved in, that date is like 30 days. And some of them were 0. The person was enrolled in a program and did a move-in at the same time. Now, I really want to know how you guys do that, or how somebody can do that, because how do you enroll them, get all the documentation, inspect the unit and everything else in one day? It appears that we're holding off the enrollment till we have all the documentation, then we're enrolling and moving in, which looks, for your length of time homeless for your program, it might make it look good, but the problem is length of time is measured on the system and not on a program. So when we do our system performance measures for everybody in our community, which actually we are in the process of pulling that data now for submission, it's looking at when Pat Frey entered the system as homeless to when Pat Frey moved in, and anybody who touched her along that way. So really, really important that we understand that when a referral's made, that client needs to be enrolled in a program. That doesn't mean that you don't have 100% verification that they qualify, but based on face value, you make that enrollment, then you start to work on that documentation. If the documentation doesn't come to fruition, or in your quest, you find out for some reason the person doesn't qualify, you exit them from your program. Needs could not be met by a program, and keep moving. Now, on the other hand, someone's going to say, well, that means I'm going to have an unsuccessful exit. Well, guess what? That's the real world. That's the world we deal with when we deal with people. Nothing's going to be 100% one way or another. But if we're not engaging our clients with coordinated entry at the beginning of the process, we are doing them a disservice, and we're lengthening the time homeless, which means there's less people that we can serve. So last week when we had our housing navigation meeting, we started talking about challenging ourselves to make sure that everybody that encounters any of our programs who is experiencing literal homelessness, again, in a shelter, in a place not meant for human habitation, making sure that those individuals and or those households have an active coordinated entry referral, which means it needs to be within the last 90 days. If it's the 91st day, it is no longer active, because that is the reset for any kind of coordinated entry intake. Again, our chair said at the beginning, it's about eradicating homelessness in our community, and it starts with housing. That you make someone, or you help someone to end their homelessness by giving them housing. I'm sorry, I was reading the chat at the same time. I apologize. I can't do two things at one time. But whether it's emergency or rapid
Pat, I think you may need to mute everybody again.
I'll give it a try. Okay, can y'all hear me? Someone give me a nod. Okay, cool. But like I was saying, if we want to end homelessness, it begins with housing. And the only way we can access housing is to, I'm trying to get this little thing off. There we go. Is to make sure that we enroll all of our clients in coordinated entry. And you know what? Again, it is not our job to say when we first encounter somebody who qualifies, who doesn't. As we all know, whether you are doing an HMIS enrollment, you're filling out a form for or with a client, you are taking the information they're giving you at face value, and then as you're trying to qualify them for other programs or other assistance, then you have to supply the documentation needed. Successful enrollments or exits always begin at enrollment. If you start out with a client with the goal of housing, that you are 50% of the way there. There is absolutely no reason that any of our clients should be asked to go to another agency or go down the street or anything else to be able to enroll in 211. It's either a phone call to 211 or the 10-digit number. If it's a prepaid phone, sometimes the 211 gets another area. So the 10-digit number of 706-405-4775. And yes, Candace, I remembered it because I wrote it down this time. Or we have a Google Doc on our website, which there's a link here, and we will be sending everyone a copy of this presentation. We will also post it to our Facebook and to our website. This Google Doc is the coordinated entry intake that the 211 operators do with someone. Our marketing department did a fantastic job of making it so user-friendly. There's only 1 or 2 fields that are required. So someone's intake is not going to get lost because they didn't fill everything out. Again, we would much rather get the other information on the back end than the client not get the information in at all. So the onus is on us as providers. It's what we all do, is connecting our clients with the process and the systems in order to end their housing. So I'm going to challenge everyone again, looking at your clients. When you are with a client, taking a look very quickly when in HMIS, and just making sure that there's a coordinated entry enrollment. If you're not an HMIS user, that's okay too. Pick up the phone, give us a call, shoot us an email. We will be glad to help. You can do the 211 intake with your client right there as you're working with them. So, in fact, it's ironic, and Candace, everybody's gonna think we rehearsed this. Today's 211 day. I just dawned on me. Oops. So I'm gonna let you talk about 211 before we're gonna go on to Terry.
Well, Pat, I just wanted to say too, that we would rather have someone, if they're not on HMIS and they can't see if they're enrolled in coordinated entry, we would rather have them do that intake again than have them, drop through the cracks. It's not really creating any, additional work on us. And who knows, we may get additional information that we didn't get on the initial intake. Especially contact numbers change a lot. So, I would, on my end, and I'm the person who gets all of those online forms, I would much rather get a double intake on someone than have someone slip through the cracks or not go through the proper procedure.
Thanks for that, Candace. And congratulations on 211 Day. Today
Thanks.
is,
And Pat, can I say one more thing?
sure.
I don't think, from the numbers that you showed before, I don't think people get the true volume of what comes through coordinated entry. In the calendar year for 2020, we had over 1,000 calls that came through coordinated entry that then had to be sorted through. Some people weren't truly homeless, and we were able to give them resources, but I think it's a huge credit to your staff, the time and effort that goes through sorting through who is homeless, who isn't, what their needs are, and how those needs can be met, not just the housing.
Well, Candace, I appreciate that. And kudos to Kathy and Tammy and Terry and the new members of the staff, Nashada and Dave and Denise, who have started getting their feet wet in coordinated entry and all of those aspects. But you're right, and it's amazing. It takes actually an average of 2.5 calls per client in order for us to close the loop on coordinated entry. So if it's 1,000 calls, it then becomes 2,500 calls once we're closing the loop on those 1,000 clients. So thank you for that. And again, so 211's been in Columbus 6 years now? 7 years. Congratulations. It is sort of ironic. I didn't even know that, it didn't dawn on me till we were talking that today was your day. All right, gonna go over to, again, we talked about point and count briefly a few moments ago. As many of you know, we normally do our point in time count the last 10 days of January, but due to COVID-19 and all of the things that came along with it and anticipation of a post-holiday surge of infection throughout the country and in our community, especially for us, we sought and were granted a waiver from the Department of Housing and Urban Development to move our count. And we moved it about 2.5 to 3 weeks later than we normally do it. So, next week. And we moved it just a little bit in anticipation that we wanted to have room to be able to move it again should we have to. Our reporting deadlines and all for our national, our federal reports and all have not changed. We still have to have all of our data in by April 30th. So we wanted to have some wiggle room should we need to move the count again. So we moved it to February 16th and 17th, and based on our numbers and consultation with local authorities and health professionals, we decided about a week and a half ago not to do a postponement of our count, but to go ahead and move ahead. So next Tuesday evening, we will be doing the sheltered count for the shelters in the Muskogee, Russell County area. Excuse me. All but 2 of the shelters will be doing a staff run count. Again, trying to minimize the number of people in and out of shelters and exposure to anyone. And thank you for those shelters and their staff for doing those counts. And then so we will have two shelters that we'll be going into on the night of Tuesday. And then Wednesday morning, we'll be back here bright and early, just do the unsheltered count. We'll start about 5:30 with a little light breakfast and getting everybody set up and ready to go. And then we'll be hitting the streets. We have fewer volunteers this year for a number of reasons, but we do have adequate coverage thanks to our chair, Curtis and the folks at the Sheriff's Department, and Chief Blackman at the Columbus Police Department, and Chief Ray Smith across the river at the Phoenix City Police Department. For everyone going out on the unsheltered count, we will have law enforcement personnel to accompany those surveyors. We will have, of course, masks for everybody, excuse me, who might need one, be they a client or a surveyor. We have hand sanitizer and all those kinds of things ready for everyone. We could use a few more volunteers if someone who has done it before wants to. It's the same app we've used before, and we can get you training really quickly. But I think we have adequate coverage, and we're looking forward to seeing what the numbers are going to be on next Tuesday and Wednesday. We hope to have preliminary numbers by the following Monday. So that would be the 22nd. Yes, by the 22nd, we hope to have preliminary numbers out to the community. Next thing I want to talk about briefly, I'm not going to sit here and read these slides to you. But it is time for us to ask for new members to some of our committees in our continuum of care. Performance and outcomes, one I just talked about a little bit ago, where we look at how our system is performing and then break it down to organizations to make sure that we're meeting the needs of the clients. We also are using some of the information from performance and outcomes and our system performance measures to seek a gap analysis from a HUD technical assistance provider as we're looking at developing a 3 and 5 and 10 year housing plan for our community. So I'm going to just quickly scroll through some of these committees. At the end of today's presentation, again, we will send everybody a copy of this. You'll have a link to, once again, update your membership form for the COC, and there's a description of all of these committees. We ask that everybody consider being on one or more. If you want to experience that you're more than welcome to. Going forward, starting this year, thanks to our COC board willingness, every one of our our COC committees, HMIS performance and outcomes, mainstream outreach, and all the rest of them will have a COC board member on the committee. So we have, again, the application committee is when we normally do our federal funding request, mainstream and outreach, meaning literally outreaching and the homeless population, especially the unsheltered, but also connecting with mainstream resources such as employment. Got some interesting things coming down the pike with that, with some employers heading up some of these initiatives. So that's going to be really, really, really exciting because there's nothing that makes anyone prouder and give anybody a purpose other than being able to care for themselves and make a living to take care of their family. Our HMIS committee and satisfying all of the needs of the users, but also making sure that our data is clean, submitting reports, but also being able to analyze the information we collect from all of our clients to make sure we make decisions that are in the best interest of our clients so that we have a client-centered approach to what we do and not a program-centered approach. We're not trying to make the client fit the program. We need to have programs to fit the client's needs. Our coordinated entry, I think I've talked about that enough today, making sure that everyone comes into the system the same way, gets assessed the same way, and gets referred based on their needs. Again, based on the needs of the client and not on the needs of the program. Our point in time count committee, I think our chair of our point in time count is actually on the call today, Holly Browder. Holly has done a fantastic job of helping us to pull off, a normal activity in such abnormal times. And Holly did a interview yesterday with WTVM talking about how and why she's been involved with point in time count for several years. And it's, again, assessing the needs, who's out there, what their needs are, and how do we move them forward. Interestingly enough, and I'm going way off script here, and Terry's got some things to talk about equal access. And I'm gonna turn it over to her in just a minute. But interestingly enough, when we were talking about point in time count this morning with some of our DCA technical advisors, they specifically asked, will you use point in time count as a way to engage those experiencing especially unsheltered homelessness in coordinated entry and refer them to housing programs? So that conversation is going on in more places than here. And it's just ironic that we're all thinking the same thing at the same time, which means that the momentum is going. We're saying we created a process several years ago. We thought we perfected it. Of course, then we have a global pandemic to come along and everyone sort of has to take a step back and redefine. There's no time like now when we have extra resources in the community to really make those things count. So I'm going to hush now, and Terry's going to talk about some inclusive policies and procedures. And interestingly enough, 15 minutes before we started, I think today, a new directive came down from an executive order signed from the Biden administration. So Terry, I'm going to hush, and you're going to have to unmute yourself and take it away.
Okay. I'll turn your speakers down.
How do I turn my speaker down?
Bottom of the screen.
Mute yourself.
Pat, if y'all are in the same room, go to the little arrow next to your microphone icon, and you should be able to cut your speaker and microphone off that way to cut back on that feedback.
Michael has a shout.
Go. Don't unmute yourself.
Okay. The disparity between homelessness in the LGBTQ community and the straight and cisgender community has been well documented, especially among the youth in those groups. In 2012, HUD issued the first of its 3 rules regarding programs that are federally funded and having them all participate in equal access. If you are operating a federally funded program that provides services to the general public, then you are required to adhere to HUD's equal access rules. The first rule was that everybody would have access to the same programs. The third rule is the one that that has recently, well, it came about in 2016, that has caused a few problems, but it's not our choice. We're going to be equal and fair to all people. And it says that if you are operating a shelter that receives federal funds, you will not discriminate against the enrollment of individuals who identify with a different sex and their birth sex.
Do you need me to go?
Did we do the, okay. Well, the people who are experiencing difficulty while staying in these shelters have reported that 14% reported they were required to dress in the wrong gender. 25% decided to dress as the wrong gender because they felt safer doing that. 9% were actually turned away or thrown out once it was discovered that they were transgendered, and 44% left due to poor treatment and because they felt unsafe. It's it's required that you post the policies. The equal access rule, we've provided a poster and a link to the website, the HUD website, for you to print off your own. And they want it posted at all coordinated entry access points, all system drop-offs, drops and centers, and on the websites and online portals. These policies exist to protect both the client and the staff, and non-discrimination policies supporting the LGBTQ clients should be prominently displayed everywhere. Okay. And your paperwork should also reflect the correct gender pronouns. When you're talking to the client, engage them, carry on a conversation with them. You can start by, if it's your first meeting, by saying, you know, my name is Terry Gallops, my pronouns are her and she. And it sets the groundwork for you to develop a relationship with the client so that you can accurately assess the needs and to make the client feel more comfortable. Also, assessment tools need to be consistent and they need to be streamlined so that our systems are serving everybody, even the marginalized, especially the marginalized. It's equally important to make sure that the assessment mirror the experience the individuals we're serving. Again, that goes back to engaging the client and having conversations with them and asking questions. Don't just read the assessment to them. Your contracts and agreements also need to be inclusive. I think we already have it set up in our HMIS, our forms, I know they are set up to be inclusive. Use those forms. If you've got anything else that you are using as part of your program, make sure that they are inclusive so that you are compliant with the equal access rule. This is the poster that should be displayed everywhere. Ours is in the hallway. Ours is right when you walk in the door, you can see it. We have them in our individual offices also. If you want any more information on that, these are where we got our information through the True Colors Fund, also the HUD website, and these are also will be available in the slides and the resources that are sent out.
And the references to those items and some of the other things that Terry mentioned and the membership form we talked about all are on here as well. And I wanted to say that before we went over any other business, we will again be sending this out. It will also be posted to our Facebook page and our website. And just if I can, Mr. Chairman, before I give it back to you, we posted on our references here just to the CDBG funding notice that came out. It's the federal funding that comes to the city and that is distributed to public service and different nonprofit organizations throughout the community to meet the needs of the most vulnerable in our population. So the application season is going on right now until March the 5th, I believe, for one program, and it's a little bit later for the next program, but we posted a link there for any agency who may want to seek funding through CDBG funds. Mr. Chairman, I'm gonna turn it back to you.
All right, thank you, Pat. Great job as always. Does anyone have any other business we need to talk about today? Anything going on that you want to share to the group today?
Speaker, forever hold your peace.
Well, you know, Louis can't hold on forever.
I was wondering.
Michelle, are you there?
Yes,
Michelle,
sir, I'm here. I'm having technical difficulties with everything today, but I am here.
I had technical difficulties getting on today. It did it twice. Anyhow, thanks to Michelle, we had a good meeting yesterday with the Apartment Owners Association or Apartment Association. I reckon that covers Columbus and Phoenix City. And I think we had in excess of
Also
25
covers-
attended.
Mr. Louis, it also covers a few areas right outside of Columbus. I want to say LaGrange is
Oh,
also part of the Greater Columbus Apartment Association.
but it more than got us, before them. Of course, they have good concerns, as all landlords have, and we're all just kind of waiting. And I think Michelle and I are ready to follow through as long as we can do like Pat does. When you tell us we have money and what the situation is for passing it out and all the requirements, we'll be able to get an active participating group of landlords, not just as a core group, but I think as a total group of people that have interest more than just business interest. Because I think that in this pandemic we're going through, I think it's more than just the problems we're having to adjust to in rentals and with, just with life. And I think that they've maybe come closer to some of their tenants than maybe in the past. And they're actively, would like to have it be everybody come to the table. In other words, not just the landlords and the government or the funding, but, come so we can make sure we are working to help the person it was intended for, and that's a tenant that is having difficulties. And so I think we've got enough discussion going. What do you feel about it, Michelle?
I agree. Now, today we had with the Apartment Association, we had our property managers meeting, and that's where once a month, all the property managers, we all do a Zoom call and we discuss what issues we're facing and so forth. And our main topic was the meeting we had yesterday. And the feedback that I got was very positive. They were very excited about it. And Denise, who is the executive director, said that she had people who are in the industry that she hadn't spoken to or been able to get a hold of, who actually attended the meeting yesterday. So that's a real positive thing, that we actually reached a much bigger group of people than just landlords and property managers yesterday. We actually touched some industry people who are on the corporate level that are excited and are looking at trying to get involved with us as well.
and thank you for saying that, Michelle and Louis, but let me point out one of the things too, that part of this conversation, and as it grows, this will be an excellent opportunity for us to have that real relationship that we can assist our clients in getting housing that is safe and affordable. We're talking about raising the standards of engagement, where it's real relationship building. And Louis and Michelle have literally been working on this since last year. And so, and I mean, early
Pre-COVID.
early last year. So yes, Liz, I'm looking at your chat here. Helpful to have the housing matrix. Helpful if Home for Good is added to the approved places to obtain documentation of homelessness. Actually, yes, Liz, in fact, we sent a list to DCA. Only those agencies who actually had housing programs for the 2019 were on the list that was sent out by DCA. And we actually have asked them for clarification of that today. And the matrix, we are actually, as part of our point in time count, housing inventory count, all of the matrix are being reviewed for all of the programs to make sure that the all of the programs have their definition clearly defined and their eligibility clearly defined. However, the matrix, again, will be updated as part of the policies and procedures for coordinated entry. But the matrix is, and all referrals go through coordinated entry based on the needs of the client. So there we, I hope that answers that question. But yeah, again, what I was saying about the landlords, it's part of a wonderful conversation that has been a long time coming.
All right.
Anything else? I'm trying to read through the chat. I have not been paying attention to that. I apologize. Anything else?
Now, someone said it would be very helpful to have the housing matrix. The one on the website is really old. I don't know if we covered that one.
Yes, sir.
Okay. All right. Thank you, Mr. Louis. You always do a great job of that, and your team. And landlord engagement is one of those things that, but you're landlord yourself, so you understand how that works. But if we can get that on the front end, a lot of times people don't understand what they need to do. Tenants really don't understand the problems that the landlords have, because the landlords more than likely have to pay a mortgage on a place that they're renting, and then they've not gotten it for, sometimes it's a year or more. Now the landlord is stuck between a rock and a hard place, so we're just trying to marry them together to get them to talk and do different things and make sure everybody knows exactly what the process is, so they can get the help they need. But the landlords need help just as much as the tenants sometimes, and we understand that, but we've got to get the information out. And a lot of times tenants don't even have the information, because I know until we got clarity, we didn't know how that process worked as far as the CDC orders and different things. So we just need to keep getting the word out, and if you have a vehicle to get that out, that'll be great to help curtail a lot of this is misinformation or wrong information that's given out. So thank you, Mr. Lou. We appreciate the work you do. Anyone else have anything for the group?
Before we do wrap up, if I can, while we're waiting, if anybody else has a comment, we're going to go down the roll real quick just to make sure we're not missing someone as we're taking record of who's here. So I have Kathy Robinson, John Castile, Louis Robinson, Curtis Lockett, Renee Birkland, Neil Richardson, Holly Browder, Candace Muncie, Laura Keel, Terry Gallops, Dr. Patrick, Tiffany Cole, Kara Van Zant, Lynn Sanders, Reverend Mike, Michelle Zach, Tammy Redding, Kim Allen, Liz Dillard, Lisa Walter, Cheryl Kolb, Denise McWhorter, Kawana Hooks, Lindsay Reese. I have Liz Dillard again. That may be one of Liz's staff members. Let us know who it is if you will in the chat. I'm sorry, no, it looks like we went twice here. We got Devlon, Jennifer, James, Jennifer St. John, James Roberts, Jennifer St. John, Martha Roberts, Lauren Lynn, Katie Byers, Pam Jones, Cheryl Williams, Antoinese Wall, Kim Jenkins, Valerie Harvey, Crystal Feliciano, Kathy Thomas, Lydia Jackson, Sharda Ramrutten, Virginia Cartwright, Margelina Remington, Dave Rivera. Is there anybody I did not call?
Hey, Ms. Pat, this is Antoinese.
Thank you, Antoinese.
Jennifer Lohman.
Thank you.
Gotcha, Jennifer.
Thank you.
Thank you, sir, for letting me do roll call.
All right. All right. Anybody else? Last call. Pat, do you have any other business for the floor?
No, sir, I don't. And Liz, I see that everybody at HRN. So we've got Devlon, Michelle, Lydia, Liz. What am I forgetting? Make sure I've gotten everybody. Yep, great. Perfect, thank you.
Oh, all right then. If we have no further business, we'll go ahead and adjourn. We really appreciate you all coming on, and thank you for your time, and thank you for your work in this area of eradicating homelessness in our communities, and keep it up. And hopefully we'll see you at the point in time count coming up. And if you need anything from the sheriff's office, you can always reach out to me. We'll help as much as we can. Pat has my number, so I don't mind helping and doing what we need to do, and we really appreciate you all. So with that being said, we'll stand adjourned, and we'll see you the next time. Thank you all. Be safe. Bye-bye.